United Healthcare is the company everyone loves to hate right now. After the CEO's passing, I felt the need to dig into this company. I do find it ironic, though, that an insurance CEO didn't take the proper insurance to have security. Our goal as investors is to make money wherever possible, and the company's stock has taken a huge tumble since this incident. Is this actually warranted, or is it a great opportunity to buy? While much of the hate is currently on the CEO, his large pay package, and the company denying claims, I want to dig further into this company. Can we make money? That is what matters. Overview. United Healthcare is only one half of the total company. United Health Group is the actual company. United Health Group is made up of two arms, United Healthcare and Optum. United Healthcare focuses on delivering traditional health insurance. Optum focuses on healthcare and pharmacy. Optum vertically integrates United Health Group. Not only does United Health Group provide insurance, they also deliver the healthcare. Some would say this is a conflict of interest. Insurance should be trying to lower the price paid. The healthcare provider should be trying to charge the highest price possible. Now we could sit here and complain, and I've seen many people do this. However, what has complaining got them? It is still the same situation, and it has been for years. They still pay exorbitant prices for healthcare, and healthcare companies still make boatloads of money. I think the better thing to do with our time is to notice the scheme and then see if we too can benefit from it. This should be our first thought anytime we see a scheme in America. Can we benefit? This is a much better thing to think about rather than complaining about the situation. If we can benefit, we can essentially offset our medical costs by profiting from the same system that exploits us. This is the insanity, but also the beauty of America. Almost any scheme you see, you're welcome to invest in it and profit too. Think the banks are scumbags? Own some bank stock. Now the banks pay you. I'm sure you could think of a few schemes right now. Can this be applied to United Health Group? Let's start with looking at revenue. If we look at the long-term revenue growth of United Health Group, the revenue grows at about 12% annually. Net income grows at about 14%. These are very consistent and high growth rates. Healthcare costs inflate about 4% each year. We increase our population by 0.5% each year. This explains 4.5% of the revenue growth. The remaining 7.5% of growth is due to covering more people each year, covering more treatments, and because we are an aging population that needs more and more healthcare. All of these factors contribute to the consistent 12% annual growth rate. A good example of this is the desire to cover Ozempic. Covering Ozempic isn't free. We still pay for Ozempic if it is covered under insurance. Ozempic isn't cheap at about $1,000 per dose. If we were to cover Ozempic and a large portion of the population took it, we would still have to cover the monthly cost. If health insurance companies are able to negotiate the price down to $500 a dose, and if 70% of the affected population took it, we would need to raise everyone's premiums by $350 to cover this. It would cause insurance premiums to almost double. Thus, by covering more drugs, we also get a boost in revenue. This is why there is definitely organic push to have healthcare for all. In reality, government-run healthcare is just privately run healthcare with more steps. You can see this here on the original United Health Group mission statement. They cover Medicare. When the government covers health insurance, all they do is pay the health insurance company instead of you paying the health insurance company. Given the government is easily lobbied by these same companies, it's a very easy system to exploit. You personally may want the government to do universal healthcare. However, if you are not paying attention at every single turn, you will just enrich the healthcare companies. When the Affordable Care Act was passed, many, including myself, thought it would help millions of Americans afford healthcare. However, we can just look at the United Healthcare stock performance. It almost seems to go vertical after this was enacted. This is what makes me believe that maybe this is a company that we should invest in. I do not like fighting against strong players if I can work with them. My job is not to wage a holy war as to what is right and wrong. It is to make money trading stocks to benefit my life. Looking at the insane profitability of United Health Group and then analyzing the tailwinds behind it, it seems United Health Group is hard to beat. Claims and CEO compensation. During this incident, I think there's been far too much discussion of United Healthcare denying claims and CEO compensation. Let's start with claims. This chart has been floating around the internet talking about claim denial. Now, I can't find anywhere that verifies its authenticity. However, whether it is authentic or not is irrelevant, and I will explain. You may hate the CEO for denying claims, and many people have brought this up as justification. However, I think this is very naive. Even in a world where the CEO loved everyone and wanted to approve every claim he couldn't do it. I know this might be hard for some people to believe, but the company does not have infinite money. They can only pay claims if they have the money to do so. United Healthcare declined 33% of claims. If they accepted every single one of those claims, their costs would go up 50%. We need to actually break down how these companies make money so that you can understand they cannot pay the claims even if they want to. The breakdown is as follows. We pay insurance premiums. 85% of this premium is spent treating people. I know that's frustrating and we wish it was 100%, but the business has to operate. 10% of the money is spent running the business. This pays the people that processes the claims, etc. 5% of the money is profit. If we paid people nothing to run the company by instituting slave labor and we removed all profits, we could only get 17% more claims paid. This does not cover all rejected claims. The only way to actually cover every single claim, like people suggest, is to raise insurance premiums 50%. Insurance companies want this to happen. A misconception is that insurance companies want to deny claims. Denied claims means they don't have to pay the money. That means profit, right? If they were to deny 100% of claims, then they could get 100% of the premiums, right? Except we need to refer back to our breakdown of the company. 85% of the money is spent treating people. This is not a suggestion. It's actually something that the company has to do. They have to do it to keep their Medicare contracts with the government. The company actually can't just deny claims to make a profit. They have to actually spend the 85%. You will see this across every single health insurance company's financials. However, the company won't spend more and purposely lose money. Insurance companies fight to cover more drugs. Of course, this coverage isn't free. It comes with a subsequent raise in premiums. Insurance companies try to get the government to cover more drugs and pay the subsequent premium cost for it. Referring back to earlier, this is why premiums grow at 12%, even though we can only account for 4.5% of that growth between population growth and healthcare inflation. The remaining 7.5% comes from covering more drugs and more people. All the insurance company cares about is their essentially mandated 5% profit margin. They will always pay the 85% of the money out that they have to. They won't pay more though and lose money on purpose. And that's why we have denied claims. Now, we could remove the 10% operating cost and the 5% profit margin and institute slavery in this industry, but like I said, we will only get a 17% boost, and that assumes everything goes smoothly. As you can see, no matter what, you get denied claims. It is an inevitability of the system. You can only get out what you put in. There is no magic way to have all healthcare be covered whenever you want it to be. I know people want to say healthcare is a right, but we are still constrained by the money. Now, let's move to compensation. The CEO is made out to be the villain who is profiting from this, but I'm actually going to explain to you that he's just a low-level mini-boss. People make it out to be as if he owns the company. I will agree, $20 million is a lot of money to be paid to a CEO. However, to put it into perspective, it would still take 50 years of a $20 million salary to just get $1 billion. I can hear you now saying, why does it matter that it would take 50 years? It's still an insane amount of money. The reason I bring this up, though, is that focusing on the CEO is the wrong person. The CEO makes $20 million a year, but the shareholders who own the stock, they're getting paid $7.4 billion a year in dividend payments. And this doesn't even begin to talk about stock buybacks. When you dispatch the CEO, you're actually just dispatching the middleman. In reality, the shareholders are making far more money. $20 million is chump change compared to $7.4 billion. Thus, the real profiteers are the shareholders, and most of those shares are owned by funds managed by Vanguard, BlackRock, and State Street, and those funds are sitting in American retirement accounts. So I would actually argue shareholders of United Health Group, every single person with a retirement account, or people with shares in the S&P are really the people who profit. These stocks sit in the retirement accounts of teachers, police officers, and tons of other people. I have seen no movement from these people to divest from these stocks. In fact, I have seen no movement anywhere from anyone to divest from these stocks. If they are so evil, why do these people still want to own these stocks? While many are willing to criticize a CEO, it seems very few are willing to divest from the profits of these companies in their stock portfolios themselves. Conclusion. Given the backdrop I've presented, I really believe the public rage against United Health Group is misplaced. The CEO has no maneuvering room to approve more claims. As I've shown, it's quite a regulated business. While many Americans despise the healthcare system, the data is more complex. When you ask Americans whether they think healthcare is bad, they say yes. But when you ask them whether they think their personal healthcare is bad, things change. They no longer believe it is that bad. I think lots of people buy into narratives even though they don't personally experience them. If we refer back to the claim denial graph, Kaiser is one of the least denied insurance. I personally have Kaiser. I will say it's very good. However, it may also be the least denied because it's a vertically integrated system. They know what will be approved because it's in their system already. United Health Group is a third party when they aren't using their own Optum service, and thus a doctor will try to get something approved without knowing whether it will be and get rejected. The rejection stat is definitely misleading. If we look on Reddit, we can see numerous posts of how bad Kaiser is, despite them having the best claim denial rate on this graph. The healthcare system can definitely be improved. In my opinion, price transparency is the most pressing issue. However, I think the focus on a CEO and claim denial is short-sighted. CEOs will always be replaced as long as shareholders are making billions of dollars. Claims can't be infinitely approved as they are a function of premiums. If we want to approve more claims, we have to pay higher insurance costs, and people don't want to pay more for health insurance. They want it to magically show up without having to worry about the cost. There's a lot more about health insurance companies we can talk about. This really only scratches the surface of these complex behemoths. Perhaps I will dig deeper into this one day. Anyway, I hope you learned something today. Things aren't really black and white. Everything has nuance. I own United Health Group and other health insurers to offset my healthcare costs. Are you thinking of doing the same? Let me know in the comments. Bye.